Good morning, participants. I sincerely wanted to be with you in person, but unfortunately, I have been unable to adjust my schedule to participate into this important conference with you. But it's a very important moment for Nigeria's health as the country is undergoing several transitions, and health is a core component within that transition. We're undergoing an epidemiological transition. We're seeing shifts in burden of disease towards non-communicable diseases that are fast-growing. We are having a demographic transition, even though it's slow, with a very fast-growing, both youthful population that has a lot of promise in terms of productivity and economic development over time. We are also seeing aging, which is adding to the non-communicable disease burden, and an economic transition with our economy diversifying, and we expect that to continue. Within that, health is a core aspect for preserving, accumulating the human capital that is necessary for our growth and prosperity into the future. Health investments are important as a driver of that growth and prosperity, but also can be a consequence of that growth and prosperity. And at the moment, there's a gap between where our health outcomes are as a people and where we should be or we could be, given the tremendous resources that we have in human and material resources as a country. President Bola Ahmed Tinubu mandated us in the context of his renewal agenda for Nigeria to drive a transformation in Nigeria's health sector. We articulated a 4-point agenda focused on improving the overall governance of health, bringing stakeholders in a mixed health system that we have, public and private actors, civil society, are listening to our citizens, are responding to their needs, being accountable to them, and using data to guide our decisions, and improving the overall regulatory framework in health, not only for commodities, but for services for health professionals as part of an effort to improve governance of health, working across federal, states, and local governments, and working with private sector actors as well as our international development partners in this effort. The second aspect is to do the things that are going to improve population health outcomes. The basic things, whether it's delivery of essential services like immunization, delivery of maternal and child health services or reproductive health, commodities for women through public and private channels, dealing with non-communicable diseases in our primary healthcare system or secondary facilities and tertiary facilities. That requires human resources who can be trained by the public sector or the private sector. That requires additional financing, not only from governmental resources, but also private capital that can play an important role. That requires a strong third-party payer. The NHIA reforms and expansion of insurance coverage, I think, would go a long way in improving the affordability of healthcare, protecting our population from catastrophic health expenditures, but also enable private sector partners to count on a predictable source of financing and make investments so that they can contribute in this journey that we are undertaking. The third plank is to unlock the value chain of health. There's a value chain in the health sector, from pre-service training to the service delivery itself, with the private sector can play an important role, to the manufacturing of basic things, from where we are now 70 to 80% of our generics and pharmaceuticals on some counts are imported. With a population of more than 200 million, we've got the market that we can begin to domesticate the production of some of those consumables and basic pharmaceuticals and even medical devices. High-end things like the biologicals are going to be important because of the burden of non-communicable diseases, as well as things like vaccines, as we saw during COVID. So that's an important agenda that we will pursue, and we'll do that in a cross-ministerial way, adopting a whole-of-government approach. So that it's not just the Ministry of Health, but Ministry of Trade, Ministry of Finance, the key regulators, the private sector partners, as partners to government, including entities that have been working on this for some time, but to accelerate it given the policy priority that this government has placed on this agenda. And finally, to deal with health security as a matter of economic security and global security. It's also key to our national security, as we saw with the pandemic. Private sector actors know that when outbreaks occur, they also get shafted by them. When Ebola hit West Africa in 2014, private sector actors suffered from it. When restaurants can't open, when businesses are locked down, like we saw during COVID, when the supplies can't move because of a pandemic. And that affects the economy, but it also directly affects farms. And so farms have a vested interest to look at the health security as an important aspect and to be prepared for eventualities. Within those 4 pillars, with the mandate of the President, we are now beginning to organize and to execute on them so that over time we can track progress and show results. We do that with an approach that is acknowledging the mixed nature of our health system that sees complementary value propositions from different sectors. The private sector not only can it contribute the financial resources beyond what the state itself can do or has to do, but there are also ideas, there are ways of operating, there are innovations, there are partnerships that can be constructed between public sector and private sector to leverage each other's capabilities, to invest in infrastructure, to invest in manufacturing, to invest in logistics and supply chain approaches that will deliver to the last mile, to invest in training, to extend the production of a health workforce that can drive further the economic development imperative, and health as a key part of that. So those are all elements that we hope to bring in to transform Nigeria's health sector into the future. So this is a very timely conversation, and I thank the organizers for inviting me to make these remarks. Thank you.